I'll establish quorum. Board Member Ryder.
Here.
Board Member Tolkien.
Here.
Board Member Parker.
Here.
And Board Member Baker. Here. And Board Member Knudsen here in person. We'll suspend the requirement under moving on in the agenda. The suspension of the requirement under the policy regulation JJID/JJID-R for annual physical evaluations for students for the 2021 school year. This information is here for the public to review. But Dr. Maher, did you want to discuss, or Molly? Or
I'll begin the discussion, Molly, if you'll be prepared to clean up for me, as you often have in the last 5 years. But I think the biggest thing is COVID-19 has impacted many things that we do in the school district. This particular issue is, how do we make sure students have an opportunity to get physicals for their various activities for the coming school year? And Molly Satter has worked with our local health facilities to try to come up with a solution. Also, the South Dakota High School Activities Association has given us some latitude, and it's because of those issues that we have this issue in front of you today. Molly, do you want to clean up, maybe talk more in detail about some of the groundwork you have laid on this topic?
Absolutely. Good afternoon. So we, over the last few weeks, reached out and visited with Sanford, Avera, and Falls Community Health, as those are our biggest partners when we look at healthcare providers for our students, and really asked their feedback about whether right now is the right time, if it's safe, and if they have the capability of seeing students. What I heard is that they are all working towards getting back to those routine health visits, and that is a goal of theirs. But right now, there are time limits in when you can have safe visits. What they talked about was really focusing on getting students in for immunizations and kind of holding off on those physicals. So we started talking about that. In the meantime, there was some direction from the National High School Activities Association, and then most recently the South Dakota High School Activity Association, that both supported the easing of restrictions, or the use of the current physical for 1920 for the 2021 school year, and that would be acceptable. That comes with some exceptions. If a student has not had a physical before, they would be required to get one, and that has been deemed a safe process. Also, in the interim year, they would have to fill out an interim questionnaire, and then any yes questions would result in a follow-up from their healthcare provider or the activities, or the athletic trainer, excuse me. So there's a plan in place, and has been run through both, or like I said, all of our healthcare partners, and then there's some of that national and state guidance that has all supported this.
okay, board members, I believe you were all emailed this rationale as well by Ben and Molly. Do you have any? Oh, I think my mic's off. There we go. Sorry, I turned my mic off because I thought that was providing feedback, and I forgot to turn it back on. Board members, I believe you all received via email the rationale and so forth on this, and we've had these discussions in the past, knowing this might be an issue and so forth because of with the healthcare issues. Does anyone have any questions for Molly or Dr. Maher on this suspension?
This is Carly. I'm going to move here. I don't have any specific questions. I would just say I think it's really important for our students to have physicals, and I understand in the context of where we are at right now, the challenges in doing so. And so I guess from my point, I would really recommend that those students who maybe are participating in fall sports, just because you may not need it for to be able to begin practice or open gyms or whatever this summer, I would still highly encourage people to schedule them, even if it's September, October, whatever it is. Just because we have a waiver doesn't mean that we don't want you to get seen this year. So if you normally would have gone, we still want you to go. And for those people who maybe aren't playing fall sports but are going to be playing winter sports or swing sports or whatever, I think our hope is that this all dies down and that all those schedules open up. And so I would hope that people would continue to make that a priority to get in, even with the waiver that is in place. So like I said, totally understand the environment that we're in, but just don't want to lose sight of the importance of having that physical done when possible, and not just kind of skipping it for the year because you didn't have to, because we still want to make sure that our students, athletes and students who are in activities are healthy enough to do so.
Yeah, Carly, that really well stated. I wish I would have said that before you. And it also sounds like you were a part of the dialogue we had before we brought this in front of the board. We bring this grudgingly because we would echo your sentiment that we think it's important that you have a physical every year. You're going to go play football. You're going to go play volleyball. You're going to go be in marching band in grueling heat carrying a heavy instrument. I mean, there are good reasons to have the physical and to have the physical for this coming year. It is solely because of the health environment that we're in right now that we bring this in front of you, and I would echo everything you just said.
And I would add that we have already had, and I agree wholeheartedly, that we've already talked about the messaging and crafted some messaging that will encourage families who wish to have one to go ahead and do so, that to go in to do that. But this will give us some flexibility for those that aren't able to get in. So.
Right. So I think my only question as I'm thinking this through is for a student, say, I'll just use my daughter wouldn't qualify. Well, she would. So let's say that in 7th grade, she had a physical, so she could participate in middle school sports. In middle school, we don't require it every year, correct, if I remember?
That's correct.
Just once during your middle school years?
Correct.
So now I have an incoming freshman. So that is a person, really all freshmen, unless they've already, maybe they played a high school sport last year. All freshmen would fall into that category if participating in an activity or athletics that would require one because they wouldn't have a valid one on file.
That's correct.
Okay.
Yep. That would still be
That makes me feel better. Yep. Okay. Thank you.
Mm-hmm.
Any other questions for Dr. Maher and Molly? Seeing none, do I have a motion to suspend the requirement under policy regulation JJID-R?
So moved, Ryder.
I have a motion.
Second, Ryder.
Okay. I'll just take time. Motion by Tolke, second by Ryder. I'll take roll call vote. Ryder?
Aye.
Tolke?
Aye.
Parker?
Aye.
Baker?
Aye.
And Mickelson, aye. It passes unanimously. We'll move on now to the reports.
Okay, well, as you know, you've been getting updates from me on how the coronavirus has changed our day-to-day operations from a school perspective. And in talking with Board President Mickelson and Vice President Ryder, we thought maybe you don't need the filter of the superintendent to talk to you. Rather, let's hear directly from the departments themselves on how the coronavirus has tremendously impacted the school district. So we'll start that with the Human Resources and Health Services, we will start that with committee report from our Health Services Department and our Health Services Coordinator, Molly Satter.
Thank you. Good afternoon, board members. I appreciate the opportunity to come in and talk about how Health Services has addressed this COVID-19 pandemic. I'm going to just start here by putting up a slide that shows some various important dates over the course of the last couple of months. It certainly isn't all-inclusive, but I tried to pick some of the most important dates, and I'm going to go back to January 24th, where that was really the first communication that I sent out to our school nurses. It was some Department of Health information that talked about the virus history, signs and symptoms, and what healthcare providers should look for. So we were already on the lookout for this virus back in January. From there, we moved into February, where we reached out to the city to inquire about a work group related to COVID-19. And we also, on February 26th, sent information out to families and staff regarding COVID-19. So that was our first communication. On March 6th, we did have that first meeting with the city of Sioux Falls and various stakeholders from the community, and talked about planning and where everybody was at individually for their planning for this. Shortly thereafter, on March 10th, was the first case identified in South Dakota. From there, things picked up very quickly. We worked with local health officials, with the Department of Health, and we announced on March 12th that schools would remain open with some restrictions. Shortly thereafter, March 13th, Governor Kristi Noem announced school closures across the state, and we moved into remote learning on March 24th. So that's a brief, long time. In the days and the months leading up to the first positive case, health services worked to prepare and plan. Our pandemic plan was updated specific to COVID-19 using CDC guidance. We worked with our purchasing department to increase supplies of hand sanitizer, gloves, cleaning wipes. Masks were not recommended at that time and were difficult and cost prohibitive to obtain. CDC guidance was followed for all school functions. Operational services was using CDC guidance on cleaning procedures. Staff and families and students were provided information about preventative measures. And we also fielded quite a few questions from staff and parents regarding COVID-19. At that point, it was mostly about travel and if folks were allowed back into our buildings after they had traveled. So we followed the CDC guidance in response to those questions. Once the first case was identified in South Dakota, things changed very quickly on a daily and sometimes even an hourly basis. After the first case was identified, we provided schools with guidance, or the South Dakota Department of Health provided schools with guidance, and that information was used to guide schools to safely remain open. The Department of Health and the CDC information to develop a plan we developed a plan to remain open as long as safely possible. School nurses and administrators were given information and instructed to limit people in the building, screen people when entering, watch for symptomatic staff and students, and were given a process to evaluate and isolate those with COVID-19 symptoms. During the first few days before the first case and when schools closed, there were over 40 reports of staff, students, and families who had contact with the positive cases. Each report was investigated and followed up. All follow-up instruction was given. Health services worked closely with the Department of Health on reports of close contacts. On March 13th, Governor Noem instructed schools across the state to close. After that time, the Health Services Department provided guidance on a variety of topics, including disease prevention and safety measures at work, health procedures for meal and school material distributions, health procedures for essential home visits, and determining when it was necessary to have staff work from home, as well as health procedures for childcare for our healthcare providers and first responders, and that was specifically at Susan B. Anthony. Health Services has responded to over 90 reports of staff and students who have been in contact with someone who has COVID-19 or suspected they have COVID-19. All have been investigated using guidance from the Department of Health and the CDC. To date, Sioux Falls School District has had 8 staff positive for COVID-19, and Health Services has worked with the Department of Health to investigate each case and confirm if there were any close contacts at work. Notification and instruction was given to staff who worked in the same building when the positive staff member was at work. Some ongoing COVID-related duties for Health Services has included daily Emergency Operations Center meetings held by the city and regularly scheduled meetings with the superintendent and the COVID-19 leadership response team. Health Services has also updated district processes and procedures based on guidance from the Department of Health and the CDC and ordinances from the city of Sioux Falls to ensure compliance and safety. Health Services has also participated in calls with the city and state officials, the CDC, and other stakeholders regarding the outbreak at the local meat packing plant and how we as a community can assist and meet the involved families' needs. There has been a subcommittee of Sioux Falls School District leaders who meet weekly to discuss these needs and ways in which we are helping. We Also, Health Services and several Sioux Falls School District leaders completed an interview with the CDC regarding the meatpacking plant. And their inquiries were about Sioux Falls School District families and their ability to understand COVID-19 information and access resources. So looking ahead, we're looking ahead at summer programming and activities, and of course at fall. And when and how do we safely bring students back into our buildings? There's CDC guidance for schools that was developed prior to closures. The CDC guidance is to be updated to include reopening guidelines, but is not available to date. The Department of Health is looking at putting out guidelines as well. So we must look at the current level of transmission in our community and local mitigation measures and ordinances. And then we have to ask several questions. How do we social distance? What does that look like in our buildings? How are there things that we cannot safely do? And will we have enough access to cleaning supplies and PPE, or personal protective equipment? And then looking ahead to routine health practices for the 2021 school year, such as immunizations, athletic physicals like we've discussed, hearing and vision screens, and dental care. Sioux Falls School District has been in contact with Avera, Sanford, and Community Health, Falls Community Health, and all report a decrease in wellness visit appointment availability. All advise that immunizations should continue to be encouraged, which we have done with our sixth grade students. All support utilizing current athletic physicals for the 2021 school year, as we have previously discussed. A variety of resources have been reviewed in looking at routine recommended health practices, and sources include the National Association of School Nurses, the American Academy of Pediatrics, the National Federation of State High School Activity Associations, and Sports Medicine Advisory Committee. So our school nurses have remained busy during this time as well. They've been working hard on a variety of tasks. They've connected with families of students with chronic health needs. They've assisted with getting medications back to families. They've continued their required work on health, Medicaid, and special education paperwork, and continued working with on many of the end of the year routine tasks that can be completed from home. In addition, they work collaboratively, and this was something they really thought of on their own, so I was very proud and excited that they came up with this. But they worked on a website to connect families to some great resources on common health topics such as sleep, diet, immunizations, community resources, self-care, and exercise. And routine health needs are so important during this time. So this was a great resource for our families. The website also included a contact page with the nurse's email information and a short video from the nurse. So families could go there to be able to connect with their school nurse during this time and ask questions. So our school nurses will play a big role in our safe return to school in the fall. They will form a nurse committee to review literature and provide input on our practices. They will lead and guide staff and students in safe health practices at school. They'll be on, on the front lines of assessing the health of over 24,000 students and 3,400 staff. They will care for sick students and staff. They'll work with the Department of Health to help track positive cases among students and staff, and serve as a resource to the students, staff, and parents in answering health-related questions. In summary, Health Services has worked collaboratively with the superintendent and leaders of various departments across the district. It has been an honor to work with the superintendent and a team that is so dedicated to the health, safety, and well-being of our students, parents, and staff. This has been a difficult time, but we will emerge stronger because of it. Thank you.
Thank you, Molly. With the 8 staff that have been infected with COVID, have any or all recovered? Do we know as of yet?
I can't say that a good majority of them were several weeks ago, so they should be beyond that point, and none of them were hospitalized that I'm aware of. So they should all be in the recovery phase at this point, given the time.
Awesome,
Yes.
thank you.
Yes.
And great information you guys are providing to students and families. Is there also like a link on the mental health? I know I've seen it somewhere, but I didn't see that on there, so I just want to make
Yep.
sure.
And the counseling group has worked tremendously to have a whole resource where parents can connect to, and I believe it's on the remote learning platform that families can connect to that. And there is a little bit of that on that school nurse website that they developed, so we have it in a couple different places.
Perfect.
So
Thank you.
important. Yep.
Any other questions for Molly?
just as a point of reference, we did have Molly come and present to our Board of Education on the day that is Nurses Day, Nurses Appreciation Day across our nation. So I think it would be appropriate for us to say thank you and please pass that on to your staff.
Absolutely, I will. I appreciate that.
What you and your staff has done through this transition has been amazing, and it's really helped our district and our community out so much. So thank you so much for all you always do, but even now more than ever. Thank you.
Thank you, Molly.
Yes, thank you.
Okay. Thank you.
Okay, our next report today, it comes from our Human Resources Department. Here to deliver that report is Becky Dorman, our Senior Director. Sorry that took so long to spit out Senior Director.
I'm going to ask a quick question while Becky's setting up. Board members, is there feedback on your call as well?
None here. I'm not getting any.
Okay, great. There's a little here, so I just wanted to make sure you guys weren't having it as well. Thank you.
Okay, are we ready? All right. Well, thank you for this opportunity. Strategically, I had Molly go first because her presentation did a really nice job of laying the groundwork from which we made staffing decisions. So we knew what we could or should do because of the work that Molly and her team did. So Molly, thank you. We couldn't have done this without you, and I think all of us in this room know that. So. My presentation will give you a glimpse of what staff across the district are doing now during our period of remote learning. And then toward the end, I'll get a little bit more focused on what this looks like for specifically the HR department as we go into a very busy hiring season that should have started a month ago. So, all right. Okay, so we have 8 negotiated contracts that are supposed to be lined up to help us make decisions in staffing matters. With that, we have 35 different working calendars. So of the 3,400 people it takes to have school each and every day, 35 different calendars tell us who works when. And our negotiated contracts outline what happens when you can't work. Most times that's when you have a snow day or the weather just isn't cooperating and it's not safe for people to come to school. We also have language that discusses pandemics and natural disasters. However, as we got into this situation, we realized that our pandemic language really didn't fit, because the key phrase in the pandemic language is if the district is closed. Oh, yes, I didn't advance it how I wanted to. All right. Hey, Mom. Oh, no, how did I get to your presentation? Look at that. Thank you. So you're just using those arrows and now it should go. Great. Okay, great. Back to pandemic. Our language did discuss in the contracts pandemic pay for natural disasters or pandemics. The key factor would be that the district would have to be closed. And as we all know, we were very much not closed. The business of school, educating children, making sure they were fed, construction projects, paying bills, paying people, all of those things were happening. So we had to come up with a new plan. Early on in the process, so this would have been toward the end of March, Dr. Maher and a few of us other folks from IPC called together our collective bargaining groups, and we met to discuss what this should look like moving forward. Dr. Maher did a really nice job of really laying out two premises, two things that we believed in that would guide our decisions moving forward. And the first one was that our employees within our collective bargaining groups would not endure an economic hardship due to this situation. And when this was all done, we wanted to make sure we still had employees. Our employees would be retained. So with those two key pieces in mind, which we were able to get a consensus in that room, we were able to move forward. Our employees understood when they left that meeting that it was the district's intention to treat everyone fairly. But fairly didn't mean that we were treating everyone the same, because everyone had different roles within the district. But I am very proud to say that our employees have embraced their roles, and some of them are new roles, during our period of student remote learning and meeting all of the needs of our students and our community. And I'll just discuss a few of these roles. Some of them are clear and evident. We know that teachers are doing remote instruction, and they pulled off miracles getting that turned around and up and running for students in a short period of time. We have special education teachers and school psychologists that early on, they still were required by law to conduct face-to-face evaluations, and they found a way to do that safely. We have counselors, a lot like our nurses, checking in with our families, making sure that things are going and people have resources they need. Our child nutrition services staff have been pulled together. They're the ones putting the meals together and helping us get those distributed throughout the community. They have quite a rotation of staff coming in, and they should be really proud of the work that they're doing. Our social workers and liaisons, they're still working to connect with those employees or those staff, those families that we haven't heard from, or that we need to make sure they have the resources that they need. I've heard a lot from our education assistants. They're a big part of their students' lives, and they want it to continue to be a part of their students' lives. They would call in and say, what can I do? How can I help? You know, and it was wonderful to be able to redirect them back to their school. And sometimes, at a period of time, there wasn't anything they could do, but at other times there was things that they could do, like reach out to students if they could, prepare instructional materials, provide some type of remote support to teachers. They were just really anxious and willing to continue the fine work that they do. Our Kids Inc. site coordinators, we have just over 25 of them. They are the staff that are running our Kids Inc. program for our healthcare providers at our Susan B. Anthony School. So we are very grateful for their help. We still have clerical that are remaining very busy. A lot of clerical are able or found that they've been able to do their work from home and then can stop in and work periodically at school so we can maintain some type of office hours in some locations. Our custodian staff, it's very difficult to be a custodian from home. So day after day, they've been coming to work. We have found a way to help with social distancing and to lighten the load of these staff that continue to come in day after day, and we've changed their work week to a 4-day work week. and I think that's working out very nicely for them. Our technology professionals, who are used to being so visible in our schools, are now working from home and then stopping in at schools when their technical assistance is needed. I have a feeling with the Chromebook return, they're going to be super busy. Our IEP facilitators, I don't believe their work has even stopped, because IEP timelines and everything still have to be maintained. They've just learned a way to do it from home with minimal activity at school. And then we have our specialists, which encompass so many different groups, where some individuals are busier than others, and I've heard from several of them just saying, how can I help and what can I do? So it's just been wonderful, the outpouring that we've got from staff. And then our administrators, and you'll even see them in a couple of the pictures in my presentation, they're doing things that they don't normally do either. They're riding buses, handing out lunches, just always being that problem solver, that welcomer if people do need to stop in at school to pick up resources. Now, with our staff's eagerness to work and continue to help out, we were also working under the executive order from Governor Noem that targeted our vulnerable populations, where our staff were directed to stay home if you were a member of a vulnerable population. So our individuals that were 65 or older or had a serious health condition have been staying home, encouraged by the district and supported by the district to stay home in between the period of April 6th to May 11th. This impacts about 160 staff that had previously been working or who had been called to work but couldn't come to work because they were complying with the order. The district ensured that they were familiar with the paid leave options for them. It was important to the district that no staff member would suffer a pay consequence for complying with the order. We are also grateful for helping us and comply with the order would be the Family First Coronavirus Response Act. And this gave staff some more paid leave options for them. When I reviewed this, I noticed there were two distinct parts to this act. First of all, if you were ill or if you were ordered by the government or your doctor to stay home, you received 80 hours of paid leave. And so that didn't come out of your own sick leave bucket. That was free to you. So we've been calling it the free sick leave, and our employees have learned to know what that means. And then the other part of the act provided paid time for staff that needed to stay home because they were taking care of their children, because either daycare was closed or there was no school, and they didn't have health or child care available, or they might be home because they need to care for someone who's ill, or they're responsible for someone who is under a government or medical order to stay home. So those individuals receive 2/3 of their pay from this act. And then the district's response to the missing 1/3 is to allow them to supplement with their own paid leave options. Now, there are some limitations as far as the amount of time or the amount of money that individuals can receive under the act. So there are some details that the HR department works through. I won't go into those here, but they do exist. We also understand that there are some staff that get to this point of the year and they don't have a lot of paid leave left, especially if they're individuals that had a surgery or a baby or have small children. By the time the end of the school gets here, you've exhausted a lot of your leave. The district has responded by allowing staff to go negative in their sick leave and then making it up next year because they'll get a new grant next year. Now, we understand that will bring some other circumstances down the road, but there is some contract language that can allow the district to provide support at that time as well, if necessary. one of the pieces that is come from the COVID-19 situation is we want to look ahead. We want to be ready for fall. But a big piece that's missing is compensation for teachers and other staff. We've heard our governor mention several times that they're going to look at the budget again here in June. So that leaves us with some unknowns. So when it comes time for compensation at this point for our teachers, we don't know what that looks like for teacher contracts, so those will slow down a little bit. Same way as about this time now, we know what our salary schedules for our education assistants, our custodians, our clericals, we generally know what they look like, but we don't right now. So there's some unknowns there. It also comes down to, we're still hiring teachers. We did it all virtually, but we're hiring them. So when we offer them a wage, we have to say, this is the wage that we know today. This could go up or down for next year. So there's some qualifiers that come with hiring in this unknown situation. Another big piece that we have, the HR department has realized, is the travel and delays involved with hiring teachers from other countries. It's not possible right now to secure a visa. So all of our Spanish immersion programs, the dual immersion, the full immersion, middle school and high school, have had to come up with alternative plans. And I got to say, I'm very impressed with their alternative plans where we can still continue to move forward with programming. We just got a little creative. And when the time comes, we'll be able to welcome these staff, even though it may be second semester by the time they can get here. We have plans in place to make sure the programs continue. One piece that we haven't worked out quite yet in HR is how we're going to make up March and April and possibly May in the months of June and July. So 3 months of work compressed into 2 with hiring. So we're going to be getting a little creative with our onboarding of our new teachers. We, if it's like an average year, it'll be 150 new teachers and 50 education assistants before we start school. So we are working how to do some more things virtually instead of just paperwork. We have to figure out how we're getting people in to roll fingerprints, or will they allow us to go with a name check? We don't know these things. They haven't been worked out yet, but we'll get there. That's definitely something that we're planning for. As well as orientation. We're used to bringing all the teachers in and having a really great session with all of our new staff and giving them the information about benefits and leave and pay. And I believe we're going to be doing some of that virtually this year, which I think is okay, because on day one, they might not be thinking about their health insurance. They just need to know they have health insurance, and we can work out the details with them as they get more acclimated to their new roles. So it's been a great way to really dive in and look at what your individual department does, what things you can do better, and maybe what things you will continue to do because you did figure out how to do them better. So, does anyone have any questions?
It's on there. I have to turn it back on here. Once again, Becky, wow. I mean, the agility your department has done in this, being able to pivot to a totally different platform and hiring, addressing issues that no one else in our state did because of the governor's order, because of the Minnehaha and Lincoln qualifier and the executive order, and making sure our staff were taken care of, yet working from home and so forth is amazing. So thank you to all of you for doing this. I hope you're getting some sleep because I can't imagine it's much, but I hope you're getting some. And I'm hopeful that in August we're pivoting back to, what we think is a traditional school model. And so you'll have to pivot back and head that way. But thank you for everything you've done and keeping the public and the school board up to date as to everything that has to occur to do this. So many moving parts. I mean, 35 calendars. I don't even know how I wouldn't be able to do that. So thank you.
You're welcome. Thank you.
Hey, Becky, this is Carly. And I just had a random thought the other day. What had happened with teachers who, let's say, had a baby during this time and were not planning on being at school? What's our substitute situation looking like? Are we still utilizing subs with remote learning? Is it more of a team process with that grade level? Or can you tell us a little bit about that?
Sure. That was interesting. We had several babies born from mid-March until yesterday. And from what I've seen, a lot of the teachers shortened their maternity leaves. And of course, we left that completely up to the teacher, what she wanted to do. We said it was a conversation between you and your doctor on what you wanted to do. So they maybe took a couple weeks of leave and then continued working from home, seeing their students. I've spoken with a couple of them, and they just felt such an obligation to guide their students through this difficult and different time, and they felt they could do that and still be the new parent. So if that answers your question.
Yeah, and then have we been utilizing substitutes for anything for other reasons?
I think the biggest one would be maternity leaves. Most other reasons that we substitute teachers, like surgeries, or we haven't, just because they hadn't been happening unless they were
Sure.
Needed to happen. So.
Yeah, I'm just thinking, as you're doing all this hiring, which is going to be challenging, given your time frame, that, there are some people who rely on the substitute teaching as their regular income. And so will we also see a drop in our pool of substitutes just because maybe they had to seek out other employment or other income sources that maybe they won't be coming back in the fall? So that might be kind of a delayed issue that we see as well.
I do anticipate that. Our substitute pool often depends upon the entire employment situation of the city, so that will also weigh in on our available labor pool for subs.
Sure. Thank you.
You're welcome.
I would just say continued energy to you all, the teachers and the staff, as you continue to look into the future, despite the risk and uncertainties that we really have and how things will continue to operate. And you've just handled things marvelously to date, and just continued energy in all that you're doing. Thank you. Any other questions or comments for Becky? Seeing none, thank you very much, Becky.
You're welcome. Thank you for the opportunity.
Okay, we'll move on. Anything else, Dr. Maher, before we move on to committee reports?
Nothing, thank you.
Okay. Board Member Ryder, do you want to address your committee reports?
Sure. So calendar we voted on last time, so we hopefully are done for a while with that. We did have a couple policies from the policy committee that met yesterday, but no real significant reports or changes at all. So those will likely all be just review revised when we get to the meeting. And then insurance, we met, and as we continue our COVID theme of the day, obviously thinking about insurance, there's some impacts to that. So just a few things to touch on. There was a question about from Delta regarding Delta Dental. Will they be given refunds on their monthly premium since their benefit technically isn't available since dental offices are closed? And the answer to that was no. We had been working with Delta Dental as part of our negotiation of premiums, and after we had already started our open enrollment and people had been enrolling, they kind of came back and said, well, we could freeze the rates and have it not increase by the 2.8% that it was scheduled to. But since we were kind of mid-enrollment, we were not able to accept that. And so what they did is they agreed to hold our rates flat for the following year. So that will be the savings, I guess, that we'll get from that. Another question that had come up was regarding wellness participation. And, you know, to some of that, you have to be able to go to the gym X number of times each month. And again, some gyms are closed, or many people, rightfully so, don't feel comfortable going to those gyms. And so they're watching that to see what the impact of that might be for some reimbursement for some credits towards their monthly premiums to see what that will, how that might impact that. We did talk a little bit about wellness participation. Last year it was 73%. And that's participating in 3 different activities in order to qualify. And year to date, it's been 68%, so it's down a little bit. So kind of looking at reasons for that. Also, there's some of the different things. So for example, there's a wellness survey. This last year, 73% of the employees did it. This year, 77%, so a nice increase there. There's a biometric screening that they can do. 71% participated last year and 75% this year. And then there's a wellness option, which is the gym, I believe. And then 70% participated last year, and that was up to 75% this year. So really have seen a lot of good increases in driving positive behaviors with the incentives that are offered through insurance. We talked a little bit about kind of the expenses that we'll see, and as you all know, likely the elective surgeries at most of the local hospitals have been suspended. They may start up here in the next couple weeks, but because of those being suspended, they're likely not just to be canceled, but they would probably be delayed. And a lot of those are typically those musculoskeletal surgeries, so hips, knees, et cetera, and then also the follow-up therapy services. So we might see some expenses that are delayed, and which would make our costs lower during this time period. But if we balance that with the potential of patients who maybe are hospitalized because they have an infection, whether it's COVID or something else, that might offset some of that, but it doesn't sound, thankfully, it doesn't sound like that if we're only at 8 people from a district perspective. We may also just see a lag in the impact of claims. People might just, start having those elective surgeries right when school gets out, and so some of those expenses won't come until later on, and we'll have to kind of balance that out year over year. So just some interesting conversations when you think about the impacts of this pandemic. Today we talked about everything from high school sports physicals and vaccinations, hiring, to insurance. And so I just feel like there's not really an area of this that it's not impacting. And so it's easy to forget that it's not just about the person that's sick, but it's really impacting our community and many different areas. So that is my update for insurance, and I believe that's my last committee report.
Thank you, Carly. Board Member Tolkien?
I have nothing to report on.
Thank you. Board Member Parker?
Ditto. Carly covered policy and calendar. PATH obviously has not been meeting, so I don't have any reports, but I would just like to echo everybody's thoughts today. We've got Teacher Appreciation Week and Nurses Appreciation Week, and I think both of those are actually the official day maybe today, but we couldn't be doing what we're doing right now without Molly Sater and her team. And Becky Dorman and all the staff that have just been working tirelessly to educate our kids and keep them safe. And I'm just very appreciative as a parent and as a board member, and I'm very proud of what we've done over the last 6 weeks or so.
Thank you, Kate. Board Member Baker?
Yeah, thanks, Carly. She had a very thorough report in the Insurance Committee. I just had 2 things to add to that. that we'd be looking at a 2.1 cost increase with the medical rates for next year. And for dental, it would be at about 2.8% cost increase. For the Education Foundation, there's 3 items to highlight. The first one is that the teacher swap meet for 2020 has been canceled due to COVID. We are forming an educator committee. That committee would help connect donors and supporters with what is happening in the classroom. They have established the criteria for that committee and are continue to work towards selecting some members for that committee. That's also will be a feeder committee to the actual education board. The next item to report on is the online fundraising through social media. They ran 2 very successful campaigns given that it's all on social media. The first one is the Above and Beyond Award, and that's for teachers and staff that are going above and beyond during the on-time learning. They've received really positive free marketing through Kello Stories, Argus, the latest one is Dakota News. They are running this campaign through this week, which is our Teacher Appreciation Week, so it kind of ties in nicely. And then they continue to make steps with the Public School Proud grants. Those continue. So the overall trajectory, all things considered, for the Education Foundation is looking very positive.
Have they, with the Public School Proud grants, are they still awarding them then? Or, because I guess I haven't really seen anything on that yet. Or
Yeah, so what they did with that is because the buildings were closed, they were notifying the grant winners by mailing the checks and certificates as opposed to being able to do a whole lot
prize patrol thing, yeah.
Right. So, and then we've made a shift or a pivot, as you were referring to earlier, to acknowledging that we've gone to online learning, and so really focusing in on staff and teachers that have gone above and beyond to continue to build that morale, given the significance of how the teachers and staff may be feeling as a result of what they're experiencing. So to help keep that energy and momentum moving forward to ultimately impact the students through the teachers' increased energy and just being recognized for the contributions that they're making. And of course, given the stock market, there's been significant losses. But the foundation itself has continued to be able to fundraise during this time. So those are some things that are out of their control, but what has been in their control of being able to shift and do some unique fundraising, that's continued to really keep the momentum going and the dollars coming into the foundation. So they're doing a lot of really good things. Yeah. That's all I have.
Thank you. Southeast Tech Council. Southeast Tech has their virtual graduation this week, and then they'll start their summer online learning. So Southeast Tech has announced their summer programs will be online. They continue to have their virtual meetings with prospective students, and so far so good. It's looking pretty good for enrollment and so forth, but we'll see. We typically have our Southeast Tech board meeting immediately after this work session, but it is delayed to May 26th, which is a Tuesday because of Memorial Day, right before our board meeting. So it will be at 4 p.m. and it's delayed because of budget. At that meeting, we typically discuss their budget as well, but because of June being the legislator meeting again, we're delaying it to then, even though we won't know the full answer. We're just hopefully to have a better picture of things so we can start discussing it then. That's why it's not after today. Reminder that the Boundaries, anybody watching Boundaries, next input session is Saturday, 10 a.m. Everybody touched on teacher appreciation, so it's just Wednesday. You have Thursday and Friday to go get something delivered to your teachers if you need to do that. Budget. Dr. Maher and Todd Veek are continuing to work on that and keep apprised of what's going on so that we hopefully have a better picture for our school budget as well going forward. The chamber, we had a virtual meeting basically just talked about membership, the one Sioux Falls forming of basically the chamber and the Convention Visitors Bureau and all that, the rollout of all that new logo was discussed. They're also going to have some candidate forums for the upcoming election for the city council. I think it's May 14th. And I think it's at the same time as our boundary inputs. Is noon, right, it's at noon, so it's at the exact same time. So they're having a call-in candidate forum, not school board's not on that one, but the city council, to get that out in the public. Sioux Empire leadership did not meet. And just an update with our new superintendent, Dr. Stavum, Dr. Maher, and she have been working wonderfully together, and with Andrea kind of getting her calendar formed so that she can start meeting and having virtual meetings with people in our community as well as district staff so she can hit the ground running on July 1st. Anything else that anybody would like to add? Seeing nothing, do I have a motion to adjourn?
So moved, Ryder.
Second, Parker.
I have a motion second. Roll call vote on adjournment. Board Member Ryder.
Aye.
Board Member Tolke.
Aye.
Board Member Parker.
Aye.
Board Member Baker. Aye. And Board Member Nicholson, aye. We are adjourned. Thank you all.